All right, let's just jump right in. For the better part of a century, global health has kind of played by a stable, predictable set of rules. But that entire system, it's now facing a massive shock. I mean, a fundamental rewiring of power, money, and influence. We are literally living through the end of one era and the messy, uncertain birth of whatever comes next. So, this really brings us to the big question, right? What actually happens when the single most powerful player, the one who helped build the whole thing and paid the biggest bills, just unplugs itself from the network? And this isn't some thought experiment. This is the reality we are staring down right now. And that takes us straight to our first big idea: a system unplugged. We're seeing the beginning of what people are calling the post-American era in global health. You can think of it as a huge crack forming in the very foundation that's kept us all safe for decades. Now, to really get how serious this is, we have to be clear on what the World Health Organization, the WHO, actually does. It's so much more than just another UN agency. The best way to think of it is as the operating system for global health. It's the essential code, you know? It sets the rules, the standards, and the legal framework that lets 196 countries speak the same language when a new virus starts to spread. And on January 20th, 2025, that whole operating system could suffer a catastrophic failure. If the United States does formally withdraw, it would be like yanking the main power cord out of the wall. In one move, you'd remove the WHO's biggest donor and its most important technical partner. The post-American era would no longer be a theory, it would be day one. So what's the actual price of that absence? Let's try to put some real numbers on the fallout, because the impact isn't just political. It's measured in dollars, it's measured in data, and, well, it's measured in lives. Okay, first, let's just talk money. A U.S. withdrawal would instantly vaporize somewhere between 15 and 20% of the WHO's entire budget. And I don't mean a cut, I mean a crater. It's a massive shock that would cripple the organization's ability to function, like overnight. And here's what that budget crater actually looks like in the real world. This is not some accounting exercise. Look at polio eradication. The US was covering almost 40% of the funding. Those last tough vaccination campaigns in places like Afghanistan and Pakistan, they're now at extreme risk of just stopping. Or how about the Emergency Response Fund, the world's 911 for new outbreaks? It's now dangerously low. These risk levels aren't abstract, they're immediate threats. But here's the twist. As devastating as that financial hole is, the most critical loss might be something else entirely, something even more valuable: information. You see, the flow of data is the absolute lifeblood of preventing pandemics, and that flow is now in jeopardy. And this is a perfect and honestly terrifying example. There's this network informally called Gremlin. It's our global alarm system for things like measles and, crucially, for tracking mutations in viruses like avian flu. This entire network, all 760 labs, was fully funded by the US. We're talking about $8 million a year. That money is gone, and now the whole network, our early warning system, could completely collapse. Okay, so this creates a massive power vacuum. And, as we know, geopolitics hates a vacuum. So that brings us to the next critical phase: a scramble for influence. Who is going to step up and write the rules for this new era? And right away, we're seeing two major players step onto the field with totally different game plans. On one side, you've got the European Union, pushing for what it calls strategic autonomy. They believe in the old-school rules-based system. On the other side is China, expanding its health Silk Road, offering concrete things like hospitals and labs. But they tend to prefer one-on-one deals, which creates a much more fragmented system. These are two totally different visions for how the world should work. But wait, there's a third, really powerful force emerging that's changing the whole game: health sovereignty. The Global South, especially nations in Africa, is basically saying never again. They are building their own system so they don't have to depend on anyone else. The Africa CDC is now a fully autonomous agency. The new African Medicines Agency is getting regulations in sync. And get this, they've set a goal to produce 60% of their own vaccines on the continent by 2040. This is a huge strategic shift away from relying on any single foreign power. So with all this chaos, the US potentially leaving, the EU and China competing, the rise of the Global South, it means the old way of doing things is broken. And that brings us to our final part: the desperate race to forge a new order before the next crisis hits. Now, the WHO isn't just sitting around waiting to be rescued. It's actively trying to re-engineer itself to survive. The plan has three main parts. First, fix the broken funding by pushing for more stable mandatory fees. Second, bring in new money by launching investment rounds to court the private sector. And third, and this is a big one, decentralize power, giving regional offices more authority so they can act fast without waiting for permission from Geneva. It's a move to become a quicker, more resilient organization. Now, the centerpiece of this whole new order is supposed to be a new rulebook called the PABS system. It's the heart of the new pandemic agreement, and the core bargain is pretty simple. Countries have to share data on new viruses right away. In return, they are guaranteed fair access, like, say, 20% to any vaccines or treatments that are developed from that data. The whole point is to prevent the kind of ugly vaccine hoarding we all saw during COVID-19. But here's the problem. This new rulebook, which is our best hope, is maybe built on sand. It is riddled with huge, potentially fatal flaws. Its scope is vague. There's no real enforcement to make sure powerful companies or countries actually follow the rules. And a lot of the key terms are so fuzzy, they're almost meaningless. It's basically a house of cards, and that puts all of us at risk. And the clock is ticking. This timeline shows that we have a critical 18-month window to try and fix this. Negotiations are happening as we speak. The G20 in South Africa is going to tackle the money side of things. But it all comes to a head in September 2026 at the UN high-level meeting. That is the final deadline to see if this new, fragile system can actually work. So here's the bottom line. The old world order, the one built on the idea that one big, powerful country would provide for the global good, that's gone. It's over. In its place, we have a fractured world of rivals and regional powers. And the question that should probably keep all of us up at night is this. Can we build a new, resilient system out of all these competing interests before the next virus makes its move? The answer to that is going to define security for the rest of the 21st century.